Hey Refem, welcome back to My Surgeon Says, a podcast with real surgeons, real experiences, and real advice. Today I'm joined by facelift guru Dr. Richard Bloom to delve into the mysterious world of facelifts. We chat about the current obsession with the deep plane technique, what recovery is actually like, and how long do the results from a facelift really last? If there's a topic you'd like us to cover or a guest you're desperate to hear from, send us a DM or a voice memo over to our Instagram at MySurgeonSays, all one word, no spaces, and leave us a review. Apparently, it really helps people find our little podcast. Let's start chatting with what a facelift actually is. Is it everything? Is it broken down into sections? How do you define it?
Your face doesn't age in sections. The whole face ages. So patients often say they want either maybe just a neck lift or a facelift, but in actual fact, if you did a procedure that targeted just one of those areas, then you're going to get an unusual looking result because you would have corrected one area but not addressed another area. So when people come in and see me for a facelift, I do a full assessment from their brow all the way down to their neck, including the eyes, to assess which areas actually need to be addressed.
And I think with that, in terms of our coding, which we'll obviously go into in more detail with patients as they come in for their specific circumstances, there is a brow lift, a blepharoplasty, a facelift. Like there are different elements to it because obviously if people, it is age-related and it's all going as one, but if maybe they have a heavy brow, whatever, it can be segmented in that way too.
So you can certainly break the procedures up depending on need, and that comes from the assessment. But really for me, like if we're really summarising it, the top line summary, when I'm talking a facelift, I'm really talking about rejuvenation of the brow, the upper eyelids, the lower eyelids, the mid-face, the lower face, and the neck. For me, that's facelift. Now, sometimes you don't need all of those things, but a point of view that I'm assessing you from. And in general, to get a good result, you need to address all of those areas. Otherwise, it's not going to look consistent. You'll have one area that maybe looks okay and another area which relatively looks more aged.
And you really don't want to be messing with the face.
No.
What kind of patients typically are coming in for facelifts, or does it depend on which part of the face?
Okay, so there's age-related changes, and typically that was more, say, 60, 65 plus. I really think the golden age for facelift surgery is actually maybe a little bit younger than that, maybe even in your 50s. It's not such a dramatic change. So you're not going from such an extreme where you've got so much loose skin in your neck that any procedure you have ever, it's a dramatic change. And so what we're seeing more is people who are coming in maybe a little bit younger and they've got some aging changes and they want to reverse those. And then we can do a facelift, which will reset the clock. It doesn't stop the clock running, obviously, but it resets the clock. And as you age, obviously there's still aging changes, but you're still always going to look relatively better than if you hadn't had it done. So I think there's the age-related group. And then with the explosion in the weight loss medications, we're seeing a lot more patients after weight loss who traditionally we'd seen a lot of because of loose skin in their tummy, buttock, arms, thighs, all of that. And now with the sort of access to the weight loss drugs, we're seeing a lot of patients with loose skin in their face from weight loss. And so that's a whole new group of patients. Some of them are sort of patients that I've been seeing for a long time having bariatric surgery. The weight loss drugs have really opened medical weight loss up to a much broader group of people, and so we're now also seeing weight loss patients.
How does that typically manifest in terms of weight loss? Is it like around the jowls or?
The changes are very similar. Maybe not so much in the brow and eyelids, more lower face, I think. So certainly neck, very common. Jowling, and so for those of you watching, that's this area here, the jowling, and the nasolabial folds and marionette lines, so mid-face and lower face, the malar fat pad, so that's all sagged. More commonly with age-related changes, you'll also see descent of the brow, but with the weight loss, it's more lower face and neck.
Deep plane facelift has been talk of the town recently.
Yeah.
Can you kind of explain what it is and just why it's so popular at the moment?
It's bizarre. It's been around for a long time, and it seems like there's been one well-discussed celebrity case which has gone extraordinarily well, and who knows how much of it is the facelift, how much of it is photo editing.
Being a billionaire.
Yeah. What a deep plane facelift is basically the same incisions that I would make with my technique, and then you lift the skin up to a certain extent, not quite as much as what I would do, and then you go under what's called the SMAS layer, SMAS, which is just above where all the nerves are, and then you pull on that. Now, the benefits of that is there's less skin undermining and you're tightening that deeper layer.
Sorry, what's skin undermining?
Skin undermining is where you lift the skin off the SMAS, basically.
Oh, okay, so they don't have to do as much of that.
So it's like face off, like you peel all of that skin forward. So you're going under that layer. Now, the pros of that is there's less skin dissection. The cons of that are you're right near the nerve, and nerve injuries are much more common with a deep plane facelift. Proponents of it say, well, you might have nerve paralysis for 6 months. If I had a patient who had nerve paralysis for 6 months, I'd be beside myself for 6 months, and so would the patient. And when we say nerve, like I'm talking about like a paralyzed face, I'm talking about an asymmetric smile. Like it would be very, and you're not 100% sure it's all going to recover.
Especially in comparison, the way they're saying that is like when we talk about nipple sensitivity or sensation, and you don't know what it's going to get, you might not be able to feel your nipples in certain ways. And it's like, okay, and that is a cost-benefit analysis, and no one's ever really come to us complaining about that. But that is a far cry from facial paralysis.
Yeah, I think that would be devastating. Even that'd be devastating for a week, let alone 6 months. And then conceptually with the technique, so you're pulling on that deeper layer and then you're relying on connections between the deeper layer and the skin to then pull the skin with it. Okay, so that's the concept of it. The problem is those connections between the skin and that deeper layer, they also stretch with aging. So you are pulling on it. You're not as directly tightening the skin as we do with our gliding facelift. So the other limitation with the SMAS is because of where the nerves are, you're somewhat limited in the direction that you're pulling. So you can't pull directly in that way that you want to pull up and out, and because of where the nerves. So it's more you're pulling that way, and you're reorientating some of the muscle fibers. So you'll notice on some patients, and there's plenty of celebrity patients you can see, and this is what to look for, is this weird animation line along the mid-cheek that patients get when they're smiling. And that's something to do with reorientating the muscle, which just is such a telltale sign of having a facelift.
You say animation line, just for like people to imagine, it's like a puppet line across.
Correct. Yeah, like a Joker.
Joker smile, that's it.
Joker smile, yeah. So that's what we're trying to avoid. And so whilst I tighten that layer sort of on the top of it, same as the way I tighten the muscle in a tummy tuck. So when I'm doing a tummy tuck, I actually pull the skin tight, I cut off the excess skin, and the skin is pulled tight. Now I do repair the muscle, but to tighten the skin, I don't go under the muscle and tighten the muscle there and hope that the skin is just going to get tight. I actually tighten the skin. And so this is the same way that I bring the muscles together in a tummy tuck, I do tighten that layer. So if you think about your bed sheets and think about the fitted sheet under your bed, I am tightening that. But if you don't tighten the sheet over the top, it doesn't matter how much you tighten the sheet or pull on the sheet, the fitted sheet below, it's not going to tighten the upper sheet, which at the end of the day, you want the upper sheet repositioned and sitting in a better position. So I think they're the fundamental differences. I think, look, there's lots of techniques with facelift. We've gone through many evolutions just using skin, SMAS plication, which is just tightening that deeper layer, SMASectomy, so just cutting out a bit of that layer through to the deep plane. And at the end of the day, if you see someone and that's what they do and you like their results and they're good at what they do, then that's fine. But I think you've got to weigh up risk-benefit analysis as well. The other benefit of the gliding facelift is you can actually reposition this mid-cheek, which I don't think many of the other techniques address as well as is addressed in the gliding facelift, because I can directly reposition this area upwards, which is where it needs to go. This mid-cheek doesn't need to go that way, up and out. It needs to go up. A lot of techniques don't address that at all. So the deep plane doesn't really address that either. And if you look now at deep plane, you'll see they get like a nice, they do address this area quite nicely. They address the neck reasonably well. But this mid-face part here, which I think is really important, the malar fat pad, that doesn't get addressed so well.
How bespoke is your approach to facelifts? Is it because people are really coming back with the same thing over and over again? Is it just like a rinse and repeat?
There's much more tailoring in a facelift and facial rejuvenation than, say, breast reduction or tummy tuck or even breast implants. Breast implants are a little bit more bespoke. Facelift is very bespoke because, as I was just saying, there's the 4 main areas, or even 5: brows, eyes, mid-face, lower face and neck. And so you need to really have a strategy to deal with all of them, even though most people do need to have more than just one area addressed. In some cases they don't. Whereas if you compare it to a breast reduction, everyone needs breast tissue removed, everyone needs the nipple repositioned, everyone needs the breast reshaped. You're not dropping any of those steps in a breast reduction. There are cases in a facelift where you may say, look, the brows, you can maybe separate that off.
We've talked a lot about sagging skin and tightening things up. What about like fat grafting and volume rejuvenation? Is that a part of most facelifts?
Yeah. So in most facelifts, I will fat graft in this sort of mid-cheek, mid-face area, often also into the lips. Sometimes even into the earlobe. That's also an area that often gets a bit atrophied, so I'll put some fat in there as well.
That's so interesting. We talked about it in breast surgeries.
Yeah.
Is it an issue with such a small area? Like, what's the life like?
Well, you're putting a mil or mil and a half in. Right. So just some women as they age, their earlobe is a bit thinned out as well. Definitely the lips, so the Cupid's bow area. More commonly, we're also incorporating a lip lift to shorten that distance between the nostril sill and the red line of the lip. That's probably a 6th area as well, just to add to the other areas I talked about. So, fat grafting would probably play a role in 80% of facelifts, I'd say.
Is there a difference in technique between men and women who are getting facelifts? Like, is volume rejuvenation as prominent with men as well?
So men tend to have that very heavy neck. So that's more of the focus, and also heavy brow. A little bit maybe more than sort of mid-face and jowling.
Another buzzword we're hearing is mini facelift.
Yeah.
How does that differ from a traditional facelift?
Let's talk firstly what it's more similar like. It's the same as all mini anything surgery. So mini tummy tuck, mini breast aug, mini anything else that you've heard generally equates to mini results. And so, I'm not really sure what you're trying to mini. Mini the scar, mini the outcome, mini the areas you're treating. Look, you either need the surgery and you need it done properly, or you don't need it and so don't do anything. And people get sucked in. Generally, these are marketing terms. And we've seen all of them, the short scar facelifts, the thread lifts, all of these things. And they generally give either unsatisfactory results or very short-term results. There's a scar associated with a facelift. You can't do it over lunchtime. Like a full facelift with everything takes me sort of 6 to 8 hours, depending exactly what I'm doing. So it's a big day in surgery or overnight in hospital. If you want something done in an hour at lunchtime with no downtime, this is probably not the place for you to come. And not now. Like, we'll see you in a couple of years when you've realised that it hasn't addressed the issues that you're trying to address.
Because I do think we get a lot of DMs from people asking about mini facelifts, and I look at them and it's just they don't need a facelift.
Yeah.
Like there's just not one part of them. They're too young. They have aged, and so that might be shocking to them, or like they're not loving what they're seeing in the mirror. And so because they've now there's like this marketing spin of mini facelift. It's like, oh, well, that's what I need because I know I don't need a real facelift. But it's such an intense surgery. I don't think people really realise what they're signing up for to even try and opt for something smaller.
Probably this is where sort of social media has doing patients an injustice because they're luring them into this concept that there's an easy fix to maybe a problem that's not actually there or something that's very minor. Even if something's minor, generally the answer is not going to be treating it with something minor. It's probably going to be not treating it at all, or maybe with some non-surgical techniques.
Speaking of scarring, are there any visible scars from a facelift?
Yeah, I'll describe it, and also for people watching on YouTube, you can see it. So let's take like the full facelift where I'm including a brow. I start the incision at the top of the forehead and it runs in the hairline. So we're going across the upper brow and then following along the hairline until you get to the ear. I then run along the front of the ear. Very importantly, I run in front of this tissue here with this little cartilage, which is called the tragus. I run in front of that because the skin on there is very specialised. We don't want to interfere with that and bring cheek skin onto the tragus because that always looks unusual. And then follow around the bottom of the ear, around the bottom of the earlobe, up behind the ear, about halfway up, and then across into the hairline and then down along the hairline at the back. So for people who wear their hair back, there is a scar. Its face generally has a very good scar. It generally heals very well. Most people you couldn't see. If you tend to wear your hair a bit forward, then it's camouflaged by the hair. The scar that sits in front of the ear is an extraordinarily good scar. Even when I'm showing patients before and after photos in a consultation and I zoom in on the scar, even then it actually can be hard to see.
Yeah, I even think for hair back, like there were people, I was looking at ones and I was like, has she had a facelift somewhere else? Because the scar after looked so similar to, say, maybe it's like the natural tan line of where her face is tanning and then goes to her scalp, which is like shock white.
True. Yeah.
And so I was like, oh, that's a scar because I'm looking so intently for a scar because it does heal really well typically.
Typically it is a very good scar, but as we'll discuss with you in a consultation, we can't 100% control how a scar ends up, but the vast majority of face scars are excellent.
Link to our scarring episode below.
Yes.
As we've said, a facelift is a serious operation. I've seen patients come in here like a week after, 2 days after, and it's gnarly. What is the recovery like for a facelift? How long are they looking like?
Yeah, it's not really any different to every other surgery. It's just the area we're operating on is visible, so you can't hide. So I generally tell patients for 2 weeks, if you don't want people to know you've had surgery, definitely plan not to be out and about. For women in particular, by 2 weeks, you would almost get away going out and about and being able to cover up some bruising with some makeup. So I would say best case scenario is 2 weeks, maybe 3. And then after that, most of the bruising should have subsided and the wounds won't be so obvious. I definitely want to be planning not to be out and about for 2 weeks. You'll feel fine. So if you don't mind people knowing you've had a facelift, you can go out probably a week later, that's fine. But most people want to be a little bit more discreet, and so I definitely allow at least 2 weeks.
Yeah, because even if not the surgery, like there's bruises.
But take the patient I did this week, which was just a brow lift, but we'll see her tomorrow and she'll be day 3 and we'll take some of the surface stitches out. I think she will probably feel comfortable going out and about. She's got a little bit of bruising around her eyes, but not much more.
Why is a consultation so critical before surgery?
Same with all surgeries. It's an opportunity for me, firstly, to take a history, make sure you're fit and well, find out exactly what you're trying to achieve, then examining you and actually defining what the problem is, and then going through all of the options, as we've talked about before, showing you on your actual photos where I'm going to put the scars, the areas I'm going to address, and then going through some before and after photos and being able to set some realistic goals. No different to any other surgery, different to a lot of practices. I think we take the consultation process very seriously. We spend a lot of time with patients before surgery and leave it open for patients to come back as often as they like. Interestingly, I just had a meeting with someone who's developing some software to help with consultations. And so he's got this software module that is an app and patients can interact with it. And he said, it's like a pseudo interaction with the practice. And I said, yeah, well, like we actually do real interactions. So that would be a backward step. But it's just interesting that some clinics are looking to supplement the contact they have with patients with what he described as a pseudo interaction. It's hard to replace actual interaction, I think. So important to see patients in person.
How long does a facelift typically last?
Yeah, a facelift lasts forever. It's not that it goes back to how it was, but what happens is you do continue to age. So your skin, the elasticity of your skin diminishes, the dermis thins. So we're not stopping facial aging. As I've said before, you should always look better in 10 years with your facelift than you would have had you not had the facelift. So in some sense, it lasts forever. There's still ongoing aging, and you might reach a point where you say, you know what, I wouldn't mind it being reset and having a revision facelift. And I think that's a better sort of approach than trying to pull things so tightly that takes you 10 years before it relaxes enough that you look normal, and then it's good for another 10 years, and so you get 20 years out of it, as opposed to just looking rejuvenated and refreshed for the first 10 years and maybe having a revision at that point. I think that's just a better approach to facial rejuvenation than trying to create a forever result, which is impossible to really do.
Gravity always wins.
Gravity always wins. Isaac Newton?
Yeah. Michael Jackson, I think.
Famous plastic surgeon.
If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.